tell us a little bit more about your fair market pricing, if you don't mind explaining
Yeah.
how affordable can it be to see see a specialist like yourself for
Right.
rheumatologists?
So I have a different goal than some of these other things that you've heard of in the past. My goal is to incentivize chronically ill patients to get care in the clinic. Like, I don't want my patients who are flaring up to go to the ER. That's a really bad place for patients who have chronic illness to get their care. I want them to be able to get into my office. So if I had an office, an office price of $200 an office visit, well, people wouldn't be able to come in for that. So what I did was I based it on 12-month intervals. A rheumatologist is kind of a lot like a primary doctor in a way. We see our patients pretty frequently
Right.
because we're managing chronic illness. So I did it based on 12-month interval. And so this is going to be my initial pricing. So my initial price was, so if you see me one time in a year, it's $90. If you see me a second time, it's $85. And then a third time, it's $80. And then I would go down to $75. And if you needed to see me a fifth time in that 12-month period, I'd see you for $75. Now, here's the thing. If I'm seeing the patient frequently, they can even be kind of complicated, frankly. But the fact that they've been in on a regular basis and we're checking the labs and doing all that, that's actually easier for me. If somebody stays away a year and a half and then they come in with all their problems, that's a very difficult visit. So if you stay away longer than a year, things start to go up. So it really incentivizes people to get the care they need. It makes sense because the prices stay stable. To get a yearly and maybe twice a year, it's very reasonable. People find it reasonable.